PCBs. So I've been around for a long time.
Well, we're dating ourselves, aren't we?
Yeah.
Okay, and from our legal department, we have Margie Rice. Margie, you want to introduce yourself?
Sure. I'm Margie Rice. I'm a county attorney, one of 4 county attorneys, and I'm assigned to the health department. And I've been a county attorney. I started in 2002. I was at the county till 2007, and I went to the city for a while, and I came back, and I'm happy to be back at the county. Fun fact, Dr. Wren and his colleagues delivered both my babies. Dr. Wren delivered my Alex, who is now 25 years old. So I'm dating myself too, so yeah.
Is Ashley here? I can't see her on screen, but I saw a note.
She's here.
Ashley, you want to introduce yourself?
Hi, everybody. My name is Ashley Craner. Can you hear me?
We can, and I can see you now.
Okay. Yeah, you can move like the view around. But anyway, I've been on the board, at least a decade, I think. I got my master's in public health here in Bloomington. I too, Miss Dr. Wren delivered my firstborn son, Eli. That was 26 years ago. Yeah, I've really enjoyed continuing staying involved with the board and in public health, even though I work my day job at the Monroe County Recorder's Office.
Thank you, everybody. First on our agenda is public comment. One of the things we like to do to begin with is if anybody in the public would like to bring an issue to the board or a concern, we want to give them an opportunity to do so. So if there's anyone out in the public, at the bottom of your screen, there should be a raise hand button. If you would push that, you'll let Michelle, our technical person, know, and she can tune you in. So is there any public member that would like to come before the board? Michelle?
No hands?
No hands? Okay. Well, we'll move next to approval of the minutes. And we have 3 sets of minutes here. The first one is November the 13th. Has everybody had a chance to look at these?
Mm-hmm.
Any corrections that you want to note? I didn't find any. Any concerns?
I move that all 3 are accepted as written.
Okay, so we have a motion on the floor. Anybody else second?
I'll second that.
Okay, we have a second from Steve. All in favor? Okay, Craner.
Aye.
Okay, Edgerman.
Aye.
Smith again. Narelle.
Yes.
Pritchard.
Yes.
Talukian
Yes.
and Wren.
Yes.
And I also vote yes. Okay, how about the minutes of December the 2nd?
I think the motion.
No,
was
December
to accept all
10th,
3.
December 10th.
The motion was to approve all 3.
Oh, okay, all right. Is everybody in agreement with that? I'd love to do that. Thank you. Thank you so much. Okay, next on our agenda.
We have Christina, Amy, and Shauna to give you public health reports tonight.
Before we do that, I have a request, if possible, before they come on board. Steve has to leave our meeting at 4 o'clock. He has to leave early. I wonder if we might be able to go down and do the things that we vote on.
By 5:30, actually.
At 5, I'm sorry.
5:30.
Okay, well, we'll probably have time then. We'll go ahead then with this. All right, who's gonna be a first?
Amy, you want to go first? You're used to going first. We'll let you go first.
Come on, Amy.
Sure. Well, good evening. So I'm going to just give you some updates about the COVID vaccine clinic that we have running here at IU Health and some of our plans for the health department for next week's vaccination clinics. IU Health Bloomington was one of the 1A sites chosen at the state to start with a Pfizer vaccine. So we've been running a clinic here starting on December 21st with the Pfizer vaccine. This past weekend, we started with the Moderna vaccine because now we have inventory of both. We have the clinic running here Monday through Friday, 7 to 7, and Saturday, 7 to noon. And starting off, we were doing about 300 people a day, but we've increased that capacity now to 588 a day. And we've been filling all those appointments easily. We've had a lot of no-shows and cancellations, but still doing at least 500 a day right now here at the Mid-Arts Clinic. That clinic is open to 1A, those designated as 1A people from the state. So that's frontline healthcare workers, that's our first responders that are frontline. So that's been a little bit confusing, I think, for some of the community. It's not open to everybody yet. It's not open to the 1B populations just yet. It's still those frontline healthcare workers that are coming through and getting vaccinated. Right now, we've done 4,333. That was as of yesterday. About 1,600 of those were IU Health employees. So the others were, other healthcare workers in the community, other hospitals, since this is a regional site. And several of our nursing homes will have soon, if they haven't already, have CVS, Walgreens will start going into our nursing homes, vaccinating staff there as well as residents. So that's separate from this as well. We've been working a lot with Christina, so I'm not sure her report. I don't want to step over too much under her report, but we found out this week that we will be getting vaccine for the Monroe County Public Health Clinic on Friday and some more vaccine on Monday. And that's been a little bit up in the air as far as what kind of inventory we will get, but we now know that over the next week, we should get about 1,600 doses, 400 on Friday, possibly 600 on Monday. So after Monday, we'll be ready to vaccinate through the public health clinic. We have a agreement with the convention center, and I'll let Christina tell you more about that. So we'll be using that space starting next Wednesday to vaccinate. We believe with 3 vaccinators, we ought to be able to vaccinate close to 300 people a day in an 8-hour shift. So we're excited about that. And, I'll just tell you, working COVID since last March, I've never been so happy to work 12, 13, 14 hours a day right now to get a vaccine. It really just feels good. It's that light at the end of the tunnel we've all been waiting for. So I think I'll just wait, and if you have questions or if I can add to what Christina has if you want.
Are we supposed to ask questions now or wait till after Christina?
It doesn't matter, whatever you want.
I have questions, but maybe Christina it might work better if Christina presents things first, because I think she may be answering my questions.
Yeah, me too. So.
See if I can try to figure out what you all want to know. First of all, I just want to talk a little bit about the testing site. So the Optum site, we don't run that, but we do continue to be involved somewhat. So the state has still told us it's going to be available through January. They really kind of just tell us month by month if that is going to be continuing on. It's a super successful site. It's well established. People know where it's at. They see on an average 300 to 400, like high 300s to 400 every day. They've went over 500 a few times, and are seeing mostly from the site manager, mostly symptomatic people or close contacts, occasionally people that are looking to travel and have to be tested before that. Their hours are still the same, Monday through Friday, 8 to 8. They take pre-registered people that are pre-registered as well as walk-ins. And so that's running smoothly, and we'll just, we'll share that when we find out if it's going to continue. The Morton community site that we have jointly opened is doing really well. The issue with it is we just need more people. We need more people to come because they have a lot of capacity to do testing. They're seeing an average of about 65 a day. Mostly, I would say those are not mostly symptomatic individuals. Right now, it's just people that are, wanting to be tested, or sometimes that have been exposed. They prefer to take people that are pre-registered just because the registration process is a little more involved than what it is at the Optum site, but they do take walk-ins. One really exciting thing is that now they are doing the Bionex Now rapid testing, which is the 15-minute turnaround time. So it's limited supply and you have to meet certain criteria, but that is being, having that available is really making a huge difference. Instead of, a 3 to 4 day turnaround time for your results, you can know within 15 minutes, and then therefore you are going home, you are isolating, you're able to tell your coworkers or family or whoever, about quarantining. So that just gets that ball rolling much quicker. The site manager there, he told me that all the Bionex Now tests that they have done that were negative, that were followed up with a regular PCR, have also been negative. So we feel like the results are very, very accurate in what we're getting there. They are open varying day. Well, actually, it's the same schedule every week, but they have some evening hours. They're open every Saturday. And so just, if you can help spread the word about that site being open, we just need more people. And I just wanted to say both of the site managers at those two locations have just been fabulous to work with. They just are so thorough and are really step up to make sure that every patient has a really good experience and that they get the results. And, they are always so quick to, if they know of any issue with results not being to that patient, very quickly, they're always stepping in to help with that. So I just wanted to just to mention that. The other thing then with the vaccination clinic, I actually just saw an email come through that, there was kind of a debate on exactly what day we would be starting. And so it looks like Monday is the day that we are going to be starting. Surprise. So I did have on here sometime next week, but so we're just going to have to really have a quick turnaround here and, look at how to get it exactly staffed and all the supplies and everything there. Our training will be on Friday for how to use the platform. And luckily Amy has been using it. So that's wonderful that we have that partnership. We are working on, so the next group that the state has chosen to focus on, which we are required